Hello everyone, my name is Logan Wilmuth and I am an MPH student concentrating in health administration.
And my name is Caroline Edwards and I'm also in the health administration concentration.
And our third group partner is Ryan Akamazo. He's currently on a plane to Ecuador right now, but his concentration is in epidemiology.
So for an overview of our presentation, we're going to first present the case and then have a discussion about our interventions and then have closing remarks.
To give you all a background on infant mortality rate in NC, we have one of the highest rates of it in the country, and African Americans are disproportionately affected compared to Caucasians. Baby Love Maternity Care Coordinator Program was instituted by the state to provide coordinated care to Medicaid-eligible pregnant women.
Our team has worked alongside the state to develop an intervention to reduce infant mortality rates by promoting factors such as earlier entry into prenatal care, adoption of helpful behaviors and improved parenting skills, and increased time between intervals between pregnancies.
To achieve this goal, we decided to develop an intervention to provide enhanced social support, health education, and outreach to Medicaid-eligible women receiving MCC services. We did this all on an interpersonal level, and our target population were women at high risk for poor birth outcomes.
Our program addressed 3 determinants, the first one being that women reported it was difficult to get through the red tape with social services and that they weren't exactly sure what was available. We linked this to the construct of instrumental support, and in our program we will provide flyers to the at-risk women that gives information on services in a literacy level that they can understand. This will help us be able to teach women how to navigate social services, overall decreasing infant mortality in North Carolina.
The second determinant that we looked at was that more than half of the women reported that they don't feel that they have someone to talk to about their concerns regarding pregnancy. They're concerned about the effect the new baby will have on their families. So we thought it was important that the construct we chose was emotional support. So the program component was to create a small support group where discussions are led by a knowledgeable healthcare professional who specializes in pregnancy and postpartum health. Overall, we want to decrease the infant mortality rate in NC, but we want this component to provide emotional support to pregnant women. The final determinant that we addressed was that women wanted more information on how to have a healthy pregnancy, about childbirth, and about breastfeeding. So we linked this one to informational support, and having a health information table with information on prenatal, maternal, and postpartum care on the 1st and 15th of each month at the grocery stores countywide would be one of our program components. The desired effect was that we would provide informational support for pregnant women at a very easy, accessible location and overall decrease the infant mortality in NC.
So a challenge we found that could be a potential problem in our program would be finding volunteers for tabling and support groups. Some possible solutions to fill these spots would be applying for grants for providing monetary incentives for volunteers to come out and support and help with our tables, or mandating the maternity care coordinator program employees to work at a tabling event once per month.
To improve programs, we need evaluation. So we chose 4 methods of evaluation, the first being formative. So a focus group among the target population will be held to determine if the program components are feasible and appropriate for the population. Process evaluation included participants signing an attendance sheet to measure dose received and dose delivered at our support groups. Intermediate evaluation included a pre-test and post-test that will be given at the support group discussions to verify if participants increase their knowledge. And our public health evaluation will be 2 years after the program completion. We'll assess if infant mortality rates have decreased among the target population in the counties of implementation, and we'll do this through county health records.
So in conclusion, we chose a diverse approach to support our program. Our interventions will strengthen existing relationships while also building new ones, and we expect that our interventions will be successful based on our approach, the levels of evaluation, and preparation for challenges we may face along the way.
It is through this program that we hope to decrease infant mortality in the state of North Carolina. We'd like to thank you for your time. Our last slide is a list of references that we used to put together this PowerPoint.